Hey everyone, welcome to Book Club. We're doing Unlearn Your Anxiety and Depression by Dr. Howard Schubiner. So this is just the first week, chapter one. And I do have some slides to present so you can see it in a visual and written format. And so I'll just start with sharing my screen for that. And then feel free to get on the chat and write any of your questions or comments there. Okay, let me share my screen. If you join me for Unlearn Your Pain by Dr. Schubiner, you already have read the last 7 chapters, I think. The first 5 or 6, I may be wrong. The first 5 or 6 chapters are different in this book, and then the rest are the same because you actually will treat the anxiety and depression all the same way that you would treat chronic pain. So I think a few more people were coming, but okay, sorry, technical difficulties. Just wanted to make sure everyone is joining. He starts out by saying there were 2 things that he was never taught in medical school: that an injury can occur without the brain registering pain, and more surprisingly, pain can occur in the absence of any injury to the body. So he gives some examples of a man who came out of the ocean and he was really happy about something he found or caught, and he didn't realize that his leg was bleeding because he had cut it on coral, and it wasn't until he saw it that he started having pain. And then the pain can occur without any injury. There's that classic example of the construction worker who stepped on a nail, it went through his boot. He had to have sedation because he had so much pain for them to cut the boot off. And it actually went right between his toes. There was not even a scratch on him, but his brain produced intense pain. So pain does not equal tissue damage, and all pain occurs in the brain. So even though I'm talking about pain, remember this is just the same for anxiety and depression and other symptoms that we could talk about too. So pain is a response by the conscious part of the brain. So your conscious part, your brain is deciding to send pain to some input from the subconscious part. So the subconscious part is um, giving information to the brain, and then the brain is deciding whether to send pain or not. And there is no PDF for the first chapter. Um, there, it's just, yeah, sorry, it's just the slides. Dr. Schubner on his website did have the first 2 chapters of Unlearn Your Pain in PDF format, but he doesn't have that for Unlearn Your Anxiety and Depression. But I did try to summarize as much as I could, and I think this will give you a very good overview of the chapter, and then hopefully your book gets there soon. So your brain activates neural impulses that create pain following an injury to the body, but can occur following cues in the environment perceived as an emotional injury or threat. So if we are thinking something might be dangerous emotionally and we don't want to get hurt emotionally, the brain can use those neural circuits to activate pain. So if you think of the brain and the nervous system, that's kind of a little picture there, although that's getting covered a little by our boxes. Okay, so physical injury and emotional injury, quote unquote injury, activate the exact same neural circuits in the brain, both of which create pain. So it's not like your brain decides like, okay, this one's structural, I'll send some real pain for that. And this one's emotional, I'll send some other pain, mind body pain. It's all pain is produced in the brain. It all uses the same neural circuits. That's why some people will say like, but how could this symptom that's so severe be mind body? It's because it uses the same neural circuits. Okay. And they can be activated by emotions. So basically, if you think about it, the neural circuits from the brain, if you think of these yellow lines, like the nervous system that you can see there, imagine those are neural circuits. There's probably like a lot of neural circuits for all of that, but thinking of it like that, the brain activates something, neural circuits, to create fight or flight or freeze. Dr. Schubiner doesn't really talk about freeze, but fight or flight or freeze can all happen by these nervous system states. If you think of survival mode, there might be times that you want to fight the predator, or you want to run away, or you want to freeze and play dead or submit. And those are started by those neural circuits of the brain. Remember, the brain gets the information, decides if it's fearful or not. If it is, it activates these neural circuits, these states, these nervous system states, and then they're connected to the body. The neural circuits produce very real effects. So changes in muscles, nerves, and or internal organs. So sometimes people will say things like, but I actually have knots in my muscles, or it actually is tight on that side, or there is some asymmetry. But the neural circuits can change those muscles. And if you just think about it with survival states, if you're going to run away from a tiger, it shuts your digestion down and shuts your immune response down and activates your muscles, and they get tight. And so physiologically, these things change to help us survive. But if we're living in survival mode all the time, then it can be chronic, and these neural circuits just keep getting activated. Ooh, Mary says you can read the first 3 chapters of the book as a sample on Amazon. That's cool. I didn't know that. Thanks, Mary. Okay, so feel free to put in the chat how that is sounding so far. This is kind of just a review. It's actually in the preface section, and it's just a kind of really concise review of what we mean by mind body. And we know now, this is scientific research, that the brain can affect the immune system. And again, if you're running from a tiger, you don't have the time to repair the cells and fight off disease. So psychoneuroimmunology is that study. Doing the mind body work can not only calm the danger signal, but in some people also modulate the immune system. Oh, wait, this is the wrong slide. You guys, I'm so sorry. This is a slide from chapter 12. Anyway, this is a little bonus information I didn't know was on there. I just copied that presentation. Okay, so sorry about that, you guys. But anyway, fascinating stuff about autoimmune. But we're going to go back to just the basic overview of what's going on and why this is happening. So once these circuits are learned, he basically says you have neural circuits for getting out of bed and walking and brushing your teeth and signing your name. And some of the thoughts you think are just these learned neural circuits. It's like shortcuts of the brain. They're activated automatically. So it's subconscious. We're not thinking of this. In Unlearn Your Pain, Dr. Schubiner has an example of how when people are holding an iced coffee, they're more likely to see someone as dangerous than if they're holding a warm coffee. So that's just like an example of how subconscious these things might be. Because a lot of you might be thinking like, oh, I don't really have a lot of stress about this or that. You could still have these things coming up just from your perceptions that are subconscious, that something might be dangerous. So the more times they're activated, the more ingrained they become. And stress, particularly stress occurring early in life, creates these learned neural circuits, which produce the fear and danger response. So just even thinking of it like your nervous system, if you went into like freeze a lot as a child, maybe like you couldn't fight back. So the best thing to do was freeze. And when your dad yelled at you, you'd go into this freeze response. Then later in life, someone yelling at you your nervous system could just go into that same response that it did as a child as your nervous system was developing. And not everyone has a lot of the stressors early in life. So if you fall into that category, it doesn't mean that it has to be early in life and then later you have symptoms. Sometimes people have a big event, a death, or something else that's stressful that, doesn't really have anything to do with their childhood. So that is just a generalization. Okay, let me make sure this slide is right. Okay. Yes. So this response may be activated later in life under similar stressful situations. And when such a reactivation occurs, a common response in the body is pain. So sometimes people are like, why doesn't this show up until later? Well, first of all, as I look back, and maybe you too, you may have some patterns of like maybe having stomach aches a lot or having a hard time sleeping. I was scared of the dark sometimes. And an eating disorder, like all of those things are actually indicators of stress, mind body type of symptoms. And then we don't really get diagnosed with the chronic pain until later. But he says a lot of kids start with like school age and all of those pressures and performance and stuff. That's when a lot of kids start getting anxieties, and then it can escalate. So this mind-body process has been described as a psychophysiologic disorder, PPD, or as mind-body syndrome, MBS. Okay. So again, I love these concise overviews. This is how you reverse the pain. If you're wondering, you have to change how you understand the pain. And then reduce the fear of the pain, the focus on the pain, and the worry about it. And this is so important. We want to just, in general, decrease fear, and then that will decrease the danger signal and remove the driver of pain. Okay. So this is where like health anxiety is such a big thing, right? Where we get a diagnosis and it's not really understood. And then we get anxiety about any other health conditions that come up. And when we're in that state, we're actually driving more of the pain and more of the symptoms. And that's what we want to reverse. And then there is a component of processing the underlying emotions that have created the pain. So for some people, they just use the first part and don't have to dive into emotions too much. But more typically, there's some emotional work to do too. And then using the power of their minds, you change the neural circuits with a process similar to the one used in changing a habit. So you're just thinking of these circuits, they're wiring and firing, and we want to start making some new neural pathways and exercise those more and more. And then that decreases the production of those symptoms when we do that. So there is emerging evidence that treating anxiety and depression as if they were diseases can actually worsen the condition. Have any of you been told that your diagnosis of anxiety or depression, if you are diagnosed, is just something that is genetic, or that it's just something you'll have to be on medicine for? And yeah, Monique says yes. And I mean, as we know, with medical treatments, that can be fear-inducing. Fear can worsen the symptoms. And so, treating it like this is just something that's wrong with me can actually worsen the symptoms, even despite the medications you're taking and the therapies you're trying, right? And it can also, so anxiety, I'll just read it. Anxiety and depression, as well as the commonly associated symptoms of insomnia and chronic fatigue. So those are also commonly associated. They can often be treated as mind-body disorders rather than disease states. So if you've read Unlearn Your Pain, one of the big things is believing that nothing is wrong with you. So, even my clients that have had some big episodes of depression before, they can start to feel that freeze state and feel like they're going back into depression. So rather than talking about it like, oh, I have depression, this is something I deal with that just, it's genetic or whatever, thinking of it as there's nothing wrong with me. There's nothing wrong with me. I go into and out of these nervous system states, and these neural circuits that I've practiced got really good at firing a lot, and I can make new neural circuits and unlearn these symptoms. Oh, silly me. There's another slide from the last book. Just mixed them in. Okay. I love this quote. Anxiety is like a rocking chair. It gives you something to do, but it doesn't get you very far. So, I mean, just taking that analogy a little further, if you were just sitting there rocking and rocking and rocking, you're going to get tired and you're not producing anything. You're not getting anywhere. You're not, doing anything helpful. At the very root of everything, anxiety is fear. So you can just think of it as an intense fear. And fear is powerful. Oh, yeah, quick question that I just read from Anna. The antidepressants, yeah, the book actually does say for some people, they need medication and you can do both. You can use antidepressants along with this or anti-anxiety, and then you may eventually want to get off them, but you don't have to necessarily. So the main thing is that you're just not thinking of it as like, I have this disease and something's wrong with me, but like how I like to think of medications is I'm doing this to help support my nervous system. Like I can do a lot with my brain. I could probably do everything I need to with my brain, but I also can support my nervous system, especially in that process, kind of like training wheels. But I still have some clients that take like antidepressants or anti-anxiety medicine. And they just don't like run to the doctor and increase their medicine every time they start to feel any of these emotions. They know how to kind of navigate it better. And some have even decreased or gotten off of them. So totally personal choice. But yeah, yeah, because think about the main driver of this is fear. So if you're taking away a medicine that you have a lot of comfort with and faith in, and that you really believe is helping, that's going to, for most people, increase their fear, and then that increases their symptoms. So yeah, speaking of fear, I just quoted this whole thing because it can be overwhelming. Fear can take your breath away. It can stop you in your tracks and prevent you from leaving your home. It can make you feel like you're dying. It can dry up your mouth so that words will not emerge. It can stop you from listening to a certain song or taking a certain route or eating a certain food. Fear can keep you up at night, night after night. It can make you think a certain thought over and over. So often that becomes a constant companion. Fear can make you create rituals that must be followed as if there's a powerful superstition residing within you. Fear can cause you to relive traumatic events and feel as if they're occurring right now. So it can cause actual physical things in your body because, of course, when you have fear and you go into a survival state, your body changes depending on if you're going to fight or run or freeze. And it affects all your body, your breathing, your blood flow, your immune system, your digestion, your reproduction, your genitourinary system, like all the systems are affected. Panic disorder. Okay, this slide is these are different things your anxiety might have been called if you've had a diagnosis. Panic disorder, generalized anxiety disorder, social anxiety disorder, OCD, obsessive compulsive disorder, specific phobias such as fear of heights, snakes, or closed or open spaces, and PTSD, post-traumatic stress disorder. And I mean, you don't have to have been diagnosed with that specifically to benefit from this. The more I've learned about anxiety, the more I've realized how much anxiety I've had. And I wouldn't have necessarily said that about myself before. So, especially, like I said, with the health anxiety, almost everyone at this point who's come to this point has some kind of anxiety about their health because it's been on their mind a lot. Okay, so this is a primal fear reaction, just survival states. Everyone has some fear or anxiety in situations where we feel threatened. This is hardwired in our nervous system. This is part of how we survive, is to have these nervous system states when there's an actual tiger chasing us or when there's an actual threat. But it is very easy for the symptoms of anxiety to be learned and therefore to occur more and more frequently. And that can mean you have anxiety in non-threatening situations, right? Like the boss yelling when you're an adult and have autonomy. And that's different than, feeling threatened as a child when you're small and you can't defend yourself. And people could even argue that wasn't a threatening situation, but our brain is just responding at the subconscious level, right? So it can think, my nervous system sometimes thinks like sending an email is really scary. I go into freeze about composing, an email, and I'm like, how does my nervous system think this is a mortal threat? But in our society, our nervous systems can get afraid of a lot of things, right? And especially that potential emotional hurt, like rejection or, um, yeah, we won't get into that, but you know what I'm saying, right? It's just, this is a sign that our nervous system is working. It's just like working really hard on some people. And it's like that anxiety going nowhere, like that rocking chair. Other symptoms often emerge, such as trouble sleeping, aches and pains in the body. He mentions fibromyalgia is common, co-diagnosis, which can prompt more anxiety, more doctor's visits, and more medications. And it's difficult for most people to look carefully at their lives and figure out why the anxiety is there. Okay, so for some people, it's a little more obvious. They're like, there was this event and it was traumatic, and then I had anxiety from then on. But if a doctor usually asks people, some people may not even have the ability to see what anxiety is from in their lives, which I think is fascinating. It sounds kind of weird even to hear or to say, but I've seen that so, so, so often. And just from being coached myself too, I know that you can have a really good assessment of what's going on with everyone else, but we have some blind spots about our own lives. Okay, depression at its core, depression is sadness. And it becomes difficult to enjoy things that normally make you happy. Other symptoms are you're tired all the time, even if you've slept for more than 8 or 10 hours. You move more slowly, even find it hard to think clearly. So just like brain fog, confusion, overwhelm, feeling isolated. It may take almost all of your energy to get out of bed and face the day. Your ability to function in school or at work suffers. It's a struggle to keep going, but it begins to feel like this will never end, and it may seem like it's not worth it to keep trying. And he says it can feel like a thick blanket of fog. You could have feelings of failure, guilt, loneliness, and even eventually helplessness. The body can feel fatigue, body pain, dizzy, or lightheaded. So if you look at the description of freeze in the polyvagal theory and with the nervous system regulation, it's basically these same kinds of feelings and those same kinds of symptoms. So I like to think about it like anxiety is more like flight, fight or flight, that flight state, and depression is more like freeze. That's not exactly how Dr. Schubiner talks about it. He just talks a little bit about the nervous system, fight or flight, and then also just mainly about thinking of it as neural circuits. So we just sometimes have some faulty wiring with our old circuits, but this approach is what teaches you to rewire that. So this book offers you a different approach to ending your anxiety and depression by helping you understand your anxiety and depression, figure out what caused it, and use powerful tools to resolve the symptoms. Okay, that is the summary that I have for you. So we do have a lot of time. We have quite a few people here. So if you want to put anything in the chat, I'm happy to answer questions there. Oh, someone says, okay, let's see. I'm going to look at the chat. Oh, this one is a direct message, just thanking me. Hope you feel welcome and can relax. Maybe I'm not feeling too relaxed. I think you're right. My heart is a little racing, just a little. Sometimes I still even get a little nervous with these, I guess. And then I'm in the process of tapering off Lexapro, experiencing withdrawal symptoms. I'm ready to take the tool reins. Awesome. Does anyone have a question that they want advice on or coaching on? If you want to like raise your hand or unmute, don't be shy. We actually have a lot of time. I went through that a lot quicker than I thought. probably because I was a little nervous and fast. Hi, welcome, Anna. Is it Anna or Anna?
Hi, can you hear me okay?
Yeah.
So, I have anxiety. I've had anxiety like my whole life. I struggle with chronic pain and stuff. And I've been doing pretty good, but then we started looking for a house,
Hmm.
and my anxiety is like through the roof, and I'm getting eczema like all over. Well, you probably can't see it, but I have eczema like all over my chest,
Oh, okay.
or arms,
Yeah.
and I'm just having a hard time. I'm having a really hard time with it.
Hmm.
So I don't know. Any advice would be useful.
Yeah. Yeah. So, so yeah, definitely with unlearning pain and unlearning anxiety, we want to focus on decreasing the fear. One of the ways that we can do that is through somatic tracking. So, definitely later in the book, he's going to get to all of the strategies and in depth how to go through things. But just as like, since people are here probably because they have one of those two things and want some advice of how to handle them, what we could do is just take a somatic approach. And that is one of the ways to decrease fear about it. Because what happens with anxiety is you get in this loop where anxiety gives you cortisol and adrenaline, and it really like makes you want to move and go do things and solve problems and think about things and not rest, right? So what we want to do is, instead of reacting and thinking about all those things to solve and trying to figure them out, and because then the brain's just going to find more and more and more of them, create problems for us to solve, we want to um, just label it as anxiety and then go into the sensations of it. And that's what teaches the brain to produce it less and less when we're not reacting to it. And so this probably sounds similar to pain, right? The somatic tracking when we have a sensation is one of the strategies we use.
Yeah, I've had a really hard time with somatic tracking with pain too.
Mm.
I can only do it for like 30 seconds and it causes me panic.
Oh, okay. Okay. So yeah, um let's actually just do we can just do a few minutes of some somatic tracking if you want. And
Okay.
everyone who's listening, you can do some somatic tracking on whatever your symptom is. Maybe it's a headache, or maybe it's your back, or maybe it's anxiety, maybe it's depression. And that's what's cool. You could do it on the feeling of shame. You could do, what does that feel like in my body? So it's not just for pain, it can be for any symptom or emotion. And it's actually a way of processing emotions. That's, as a coach, I learned this way of processing emotions going into the body. And then come to find out it's how you rewire your brain to decrease pain too. Oh, and Mary says your description of anxiety is exactly how I act. I get into get things done mode. Yeah. Yeah. Okay. So let's just do that. And then there's a couple more questions in the chat and a hand up. Yay. Okay. So if you guys are listening and you're in a place where you can close your eyes and relax in your chair, and Anna, go ahead and like try and relax in your chair, let go of any muscles that feel tight. It's not a forceful thing, but like maybe when you exhale, just imagine sinking into your chair a little deeper. And you can start by just noticing the breath, where you feel it in your body. If you feel it in your nose or your throat or your chest, and just focusing for a couple breaths in that area. And you can just keep your eyes closed this whole time. And since you're off camera, just let me know. You said before you've had some problems with somatic tracking and increasing symptoms. So just keep communicating with me if you're, feeling uncomfortable or anything. Okay.
Okay.
Okay. All right. So I want you to think of the stuff that's been making you anxious, the house stuff, all those things that run through your mind, and just feel that sensation in your body. And maybe scan your body a little bit as you're feeling that anxiety. What's the area that gets your attention the most?
My stomach.
Okay. And so for your stomach, how would you describe that sensation there?
just like really tight.
Tight? Is it a tight, like, um, a constant sensation of tight, or is it kind of like moving at all?
It's pretty constant, and then it goes sort of like up into my heart.
Mhm. And if there was some kind of like metaphor for it, like a like tight like a vice grip or tight like rubber bands being stretched, or how would you describe that if you could
Like
visualize it?
oily barbed wire
Mhm.
knotted up.
Okay. You're good at somatic tracking. You say it's oily barbed wire?
Yeah,
Yeah. Okay. So does it have a color?
black,
Black. And it sounds like it has a texture of that, it's that hard and sharp
oily,
and oily.
gross,
Yeah. Oh, interesting. Okay. And does it have a temperature?
cold, super
Cold.
cold.
hmm Okay. And there's not really much movement to it, it sounds like. Well, it goes up
Mm,
into your heart. Okay. But let's just focus on the stomach part. And it sounds like that's a pretty good description of it. And when you feel that sensation of anxiety, again, your brain is just going to turn to all these thoughts. And what you can do is just label it, oh, this is anxiety, and focus on those sensations. Maybe sometimes it'll feel different. You'll get a different image, but you could just think of that, that barbed wiry, oily feeling that's cold, and just like you're observing it. It's just something that's there. It's a brain misfiring, right? It's like misinformation from the brain. And usually it has to do with the unknown. So usually I'll say something like that too, like, oh, this is just how my body feels when my brain doesn't know something and it wants to know the answers. The more you can just sit with that feeling without reacting to it, then the brain produces it less and less. And so you might even, as you're sitting there, we've described it. You can describe it again in the future when you have it, just label it. And then you might have a strategy like breathing into your stomach and just see. And if you imagine the breath going down all the way down to your stomach and that barbed wire, just like a science experiment, just kind of watch what happens in your mind, see how you experience it. Maybe you imagine a warmer air as you breathe in. So it like warms up that cool barbed wire, or maybe it kind of softens those edges, or maybe it, um, dries off some of that oil so it just flakes off, or you just kind of see how you imagine it, see how it feels. And how's that going, Hannah?
it's hard.
Okay. Is it hard to get the air down there?
I mean, I can breathe and sit with it, but then I just have lots of thoughts. Like buying a house is really hard. Like, what if we buy a house and this happens? Like, what if we don't find a house? And like,
Yeah.
blah 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 blah.
Yeah.
Blah. It's just hard to just like.
Yeah.
And then part of me is like, well, it's reasonable to be stressed about this. This is stressful.
Uh-huh. Right,
But I
it
mean, I
is.
feel like,
And it also, like, there's a level of stress that is appropriate for the situation that might help, and there's also a level of stress that's like not helping, right?
yeah, I mean, it does feel like I'm being hunted for sport.
Yeah. Yeah, so we want to remind the nervous system, not in a survival threat, even though there is some stress in my life. And the more you can notice those thoughts, you don't even have to think about what they are and solve the problem of them. You're just like, there's my brain thinking. Oh, there's thinking of thoughts again. And even that act of labeling, like when you label emotions, or you just label, oh, thinking about the future, or future, past, right? You can just like label
Mhm.
it as you notice it. Then
Okay.
that brings you back to the present moment.
Okay.
This is basically mindfulness. And this
Yeah.
same approach for chronic pain too.
I mean, I think I have a really hard time approaching. Here, I can turn back on the camera. I don't know. Feel weird like closing my eyes in front of a camera. Um,
Oh, yeah.
but I think I have a hard time with somatic tracking because in all my exercises that I do for chronic pain, it's more like sort of zooming out and like a
Mhm.
distraction. Like I might do a mindfulness meditation where I focus on my breath. And
Mhm.
then since I'm not focused on my pain, I feel like that makes me feel better.
Yeah.
But like somatic tracking is like focusing on the discomfort. And
Yeah.
that causes me a lot of like panic.
Yeah. Yeah. I would say for right now, you can just start with leaning into any positive sensations in your body. So if going to the painful sensation induces more fear or panic, then you don't have to even go there at first. Do what feels a little bit better, or like you said, some mindfulness, just focusing on the breath. And then eventually, you may work towards that. But don't try to force yourself to do something that's really fearful, thinking like I've got to teach my brain, because really the overall emotion that you're producing is fear, and that's what your brain learns from it is to be afraid and not to um, decrease the symptom.
Okay. Thank you so much, Beth.
Yeah, thank you. So how to rewire away the sadness, grief, etc., driving depression. Yeah, definitely Dr. Schubiner's book. This book is going to get more into the emotions, finding the underlying cause, and how to process them. If you read The Way Out, it's a little more of like the science education, but this book and Unlearn Your Pain do a lot more of the what he calls emotional awareness and expression therapy. So, one of the ways is to actually go into the sensations of the emotion, like I was saying, like, oh, sadness feels like a anchor sitting on my chest or something, or I know like shame feels like a really heavy pit in my stomach. So that is one of the ways of getting out of those thought and emotion loops, because some grief is normal, some sadness is normal, some reactions that are even depression are normal depending on the situation, but we just don't want to get stuck in it. And so if you've been dealing with those emotions for a long time, you can process them by doing that somatic work, going into the body, and just again, not really believing everything the thoughts are saying, but just labeling them as thoughts. So same process. There's another question here, and then I'll go to you, Roseanne. I've spent a lifetime repressing and disconnecting from what my body and or emotions are trying to tell me. How to really get under my defenses and allow the negative fear-based message to come forward. Yeah, definitely in that workbook section later in the book, there will be suggestions for some of these types of things. He has a mapping technique where you can write a bunch of like freestyle, freeform words that help you get deeper into like what emotions are there and how to process them. Maybe it's like writing a letter that you're never going to send. Um, but definitely from this work, you'll start to use your body's cues as that sign that, like, okay, something is dysregulating my nervous system or something is emotional that's going on. And so you can start to see patterns and you can start to get at some of what those deeper issues might be. And let's see if that answered all of it. And so I guess it just like takes some practice, like knowing what the emotions are, how they feel in your body, what's triggering them, what kind of thoughts you're having. And then that is the way of unlearning them. Um, but like just generally, I really like just that expressive writing, Curable calls it, or Nicole Sachs calls it journal speak. I don't think you necessarily have to do it like every day and force yourself to do it, but as one tool when I'm really confused about what my emotions are telling me, that is one nice way, is just get out a piece of paper, write down everything that comes to your mind, whatever it is, however mean or evil it sounds or whatever. And um, Dr. Schubiner talks about how anger is often underlying a lot of those repressed emotions. Okay. And then I put in notes on my mirrors that say, either way, everything will be fine. A quote from Alan Gordon. Yeah. Could plantar fasciitis be TMS? Yeah, for sure. Yep. Most likely is, especially if it's been more than 3 months. All right. I think I got the main questions. There were a couple just little comments. Roseanne, let's go to you.
Hi.
Hi.
Hi. So I'm out walking. I hope that's okay.
Yeah. Looks
If
lovely.
there's a little problem, yeah, it's a beautiful day here.
I
If
can
there's
hear.
any problem with the wind getting in the way, let me know.
Okay.
So first of all, I want to say I was on vacation, which was why I missed the last 3 weeks of the other book club, but I listened to the replays. Thank
Great.
you.
You're so welcome.
Anyway,
Glad you
yeah,
could.
I listened to 2 of the 3 I missed. Anyway, I I I'll just be brief. I was married for 33 years to a man that has a personality disorder.
Mm-hmm.
And but it's like going from the frying pan into the fire because I had a dysfunctional family life when I was a kid and was very unsupported.
Mm-hmm.
And I moved out last August and I thought, okay, I can go cold turkey, or whatever they call no contact. And well, I can't because we have a business together. We have a few properties that pay our income.
Mm-hmm.
Anyway, and I've got to talk to him about some other legal details. Getting hit with a lot of fear stuff. Like our foundation was damaged because of pipes from the city, and I've got to face the city because they neglected some pipes, and so we have foundation damage. So anyway, lots of stuff causing anxiety.
Mm-hmm.
So I did some of the somatic tracking for the anxiety,
Mm-hmm.
and most of the time it lodges in like my chest area.
Mm-hmm.
And this time I did it with the anxiety, it lodged in there and it went up to my throat.
Mm-hmm.
So I thought, well, that was a good sign. But I think
Mm-hmm.
mistakenly, I thought it's not one and you're done. It's like it keeps coming back and back and back
Mm-hmm.
and back and back. It's
Yeah.
not like,
How does that feel when you say that? That the anxiety, it just keeps coming back and back and back and back and back.
well, it's anxious. I mean, it's like
Yeah.
I can never
Yeah.
get away from
That's
it.
I heard Vanessa Blackstone call it a treadmill thought, or you could
Yeah.
maybe call it a rocking chair thought, from that quote.
Yeah.
This is when we're in these states, they just feel really real, and it feels like we're never going to get out of them. Definitely with
Yeah.
depression and freeze, we're like, my life is horrible and it always has been and it always will be. So there's this phrase that story follows state, and
Uh-huh.
meaning that state that you're in, your thoughts, because you're seeing like through a lens of fear, are going to find all the fearful things, right? So your brain is just, you're in this hyper vigilant state because there are some actually, stressful things going on. And when you're in that state, it's hard to really trust those thoughts as being true, right? So even just noticing like this anxiety keeps coming back and back and back and back, that's driving more anxiety.
Right.
Mhm.
So what do I do?
So maybe you could use some of those other phrases that they say, like maybe you've used, I don't know if you've done some work on pain as well, but this is temporary. And it's like,
Uh,
it's opposite. Or you could even say it's possible this is temporary. You don't even have to like,
mm,
because your brain isn't going to just believe everything, but it's like, oh,
right.
it's possible this is temporary. It's possible, just like training a puppy, if every time they pee on the floor, instead of saying like, this just keeps coming back, I'm never going to be over it, you're like, every time this happens and we teach,
Right.
they learn a little bit more and it happens less
Right.
often.
Yeah.
Yeah,
Yeah.
having that
But it
compassion with yourself. Yeah.
well the thing is that I I know if we're on the phone for a few more minutes, I'm going to just turn this around so you can see where I'm at.
Mm-hmm.
I was, I can figure out how to do it. I was down for 18 years and unable to do all kinds of stuff.
Mm-hmm.
And I, through Curable and you and other people, I can't figure out how to turn the camera around. Anyway, I just want to show you where I'm at. I was basically disabled for 18 years, and I'm going to go on about an hour and a half hike, and I'm at the top of a beautiful mesa.
Whoa.
Uh,
Oh my gosh. Okay.
yeah,
Everyone
and
who wants a little
that's where all the
inspiration.
mind body work.
Yeah. Yeah.
But I guess what's happening is I was residual. I've had anxiety my entire life,
Mm. Yeah.
and then I had some injuries, and it was like massive trauma, emotional and physical trauma happened at one point in my life.
Mm-hmm.
And then that's when I had chronic symptoms that never went away
Mm-hmm.
until I found all these resources. Alan
Yay.
Gordon's book, The Way Out.
Good.
But the thing that I want to say is in October, I had a flare up. And this is kind of related to anxiety. In October, I had a flare up. It lasted almost 3 months. And I got really flipped out. I mean, I got
Wow.
so anxious. It was like I'd made such huge progress.
Mm-hmm.
And what happened was my brain just reverted to all
Yeah.
those years.
Yeah. Yeah.
And it kept me there.
Yeah. That's
So,
definitely possible. And our brains are just trying to alert us to this danger, but it can get the signals wrong sometimes.
so exactly. And what I did is I started doing what helped me in the first place was doing the expressive writing.
Yeah.
But it was making it worse.
Mm.
And so finally, I found a PRT therapist that takes my insurance, which was
Nice.
a miracle. Yeah. And the first thing she had me do was starting to focus on the positives and the
Yeah.
glimmers.
Yes.
And that started turning it around.
Mm-hmm.
And
Ooh,
so
I love that.
it's like
Yeah.
it's like this combination.
Yes.
And then
Yes.
I'm fortunate to live close to Charlie Merrill.
Mm-hmm.
And I went to see him for a consult to find out if it was neuroplastic or truly structural, because I did some exercises that really
Yeah.
I never would have done if my anxiety had been present.
Yeah.
Then he did it. And he said, no, I think it's neuroplastic.
Mm-hmm.
And then he gave me some exercises to do, and with some graded motor imagery,
Well,
I
good.
got my
It sounds
health
like
back.
you've come a long way. I think I'm gonna
Yeah,
stop
I
you
know,
there
move
though
on.
with your story because I really do
Sure.
appreciate it. But I do want to see if there are any other questions more about the
Absolutely.
anxiety and depression. But it's always
I
good
just
to
want to
hear
let
a good
you
success
guys know
story.
you can get over stuff. I did. If I
Yes.
did it, you can too.
And so just like you
Thank
did
you,
it with
Betsy.
pain, remember that for your anxiety as well. So when you feel, that like frustration or hopelessness or anxiousness about your anxiety, just remember this is just like what I did with unlearning the pain.
This is temporary. Thank you, Betsy. I
Temporary.
appreciate it.
Yes, you're welcome. Oh, Carrie,
Bye.
you figured out. Yeah, you're muted though. I think I can ask you to unmute. I was going to come for you next. Hey, Carrie. Oh, you're still muted though. Let's see. See if you can.
There, can you hear
There it
me?
is. Yep. Got
Okay, yeah, I started with you at the last book,
it.
but I had the Unlearn Your Anxiety and Depression book.
Oh,
And we were
really?
in a huge renovation where we weren't living at home. Anyways, I just never returned to the class. And then I was so happy when I noticed you were doing this book.
Good.
Oh, yeah, I'm happy to be here and looking forward to the 12 weeks.
Good.
Um,
Yeah.
yeah,
It's going to
just
be really thorough, really awesome.
Yeah, I mean, it's not my first walk around this block,
Mhm.
but I'm always looking to go deeper, peeling off more layers so
Yes.
that I feel more at home within myself.
Yes. Good. Well, good. Did you have a question too?
Not really, just
Okay,
I was
cool.
saying hello.
Oh, well, thanks for popping on.
Yeah.
Good to put a name and face together. Good to meet you. Anyone else have a last comment or question? Oh, someone was wondering who Charlie Merrill is. He's a PT that does mind body stuff. He was on the Curable podcast, I believe. I've seen his name there. And yeah, so then you're wondering about a Facebook group. And so that actually like is a good lead in to what I had thought about doing for this group. So I did want to offer a package, the book club totally free, and everyone's welcome to participate and ask questions here. But then I also wanted to do like a supplemental coaching package. So what it would include is 3 months of my group program, Alignment Academy. So that's my group coaching program. And there are 2 group calls per week. So you'd have 2 hours of calls where you could get your questions answered. It's Tuesdays at 1 Eastern time and Thursdays at 8 p.m. There's a podcast with the call replays, and that's where a private Facebook group is. So I actually have a private Facebook group there. And then I also wanted to include 3 individual sessions that you could use over the next 3 months. So those would be one-on-one sessions with me for an hour on Zoom. That's really good for going into what's going on with you specifically and doing somatic work together, doing some of that emotional processing, things like that. And so it would be, instead of $297 for the group and $450 for the sessions, all for just $297. So if you guys are interested in having some extra support, like a study buddy for book club, that's what I wanted to offer and talk about, so that you have a chance to get a little more help if you need it for, I'd say, a pretty dang good price. Oops, did I? Oh, wait, I'm still sharing my screen. Okay, there we go. And Charlie has chatted with Howard too. And you're welcome, Renee. And Renee, she says she's actually in Alignment Academy and says, I highly recommend it for anyone not in it. I look forward to it every week and learn so much. Oh, thank you. Okay, and Dawn, it looks like you have a question. We still have 4 minutes left, so let's do it. Oh, I think you're muted.
Yep, there I am. I'm there. Sorry, I was outside, so I have my sunglasses on.
Yeah,
So,
nice.
hi, Betsy.
Hey.
I've listened to the podcast that Charlie Merrill did with Christy Yuppie, and it was basically that sometimes your chronic pain, that even though it's not like a broken limb or an infection or cancer or something like that, that there still could be some little structural thing that can be contributing to that pain. And for my chronic pain, I'm not going to own it. It's not going to be mine, but for the chronic pain that I have in my body, that is what is driving my anxiety, the anxiety sensations in my body. And so I had been treating myself with just mind body practices all of this time, but I did reach out to an osteopath who looked at my situation and said, I do think there is something, not necessarily structural, like surgery structural or whatever, but and because of what's happening in your gluteus median, that is putting pressure on your sciatic nerve and piriformis, your muscle has contracted completely and it stays in contraction. And that is, that's part of anxiety as well, is that it's in a constant state of contraction.
Yeah. And we know
You know,
nerves can be compressed and not have symptoms too. So if this is
right.
longer than 3 months, it's
Yeah,
sounding really neuroplastic.
yes.
Yeah.
Yes. I do. I agree. I agree. I think
Yeah.
about like 95% of what I'm dealing with is neuroplastic.
It could
And
be up to 100 because that's not one of the diagnoses that it's not a tumor, it's not a fracture, it's not infection. Like a
it,
muscle tightness is like
well,
classic
I tore a tendon 8 years ago in my
Yeah.
gluteus medius.
Yeah.
Actually, a whole
It's more
tear.
than 3 to 6 months. Yeah.
Gotcha. Okay.
And here's how you can just prove that to yourself. Cause like, I don't
That's
want to, like, of course I have my view and I've talked to you for 2 minutes. So I'm not going to say like, this is but you can prove this to yourself by looking at those fit criteria that Dr. Schubiner has. So the
okay.
fit criteria would be things like, does the pain come and go? Is it different when I have a stressful day? Was it ever better? Any one of those days, like maybe I was on vacation and I didn't feel it. So if you have symptoms that come or go, or, you'll look at that whole criteria, all of them.
Yep.
If you even have one of them, you can rule in that it's neuroplastic. And
Okay.
so this is the biggest question I do see. It does relate to anxiety, like you said.
Yeah.
Almost everyone believes, well, I'm that exception that has something structural and something neuroplastic. And
Okay.
that does create anxiety a lot of times. Even Dr. Schubiner has said, if you have autoimmune, this has changed over the years that I've been following him. Now he says, this can be helped to some degree with mind body. So the more you can tell yourself things like, I'm safe, this is okay, I'm getting healthier, I'm getting stronger, those types of things versus focusing on, I have this real structural thing, that'll help your anxiety a lot too.
Okay. Is that list in the book?
You know what? I'm not sure if it is in this book because I know I haven't
Is it in
even
the
read all the chapters of this book. I've read
is it
Unlearn.
in the pain, is it in the pain book?
Mm-hmm.
Okay.
Yeah,
I have
and
that book.
if you're in the Tell Me About Your Pain Facebook group, it's pinned at the
Yeah.
featured, there's like a featured section at the top,
Mm-hmm.
and they talk about the fit criteria a lot there. So for
Okay.
anyone who's in doubt and still thinks theirs is structural, there are very, very few cases of that. You'd be in the small minority. So,
Okay. Great. All right. Thank you, Betsy.
okay, yes, thank you. And then Carrie says, where can I just listen to you on a podcast or YouTube to get a better feel for what you fit? Okay, for the additional coaching support. Oh, okay, so my podcast is, I wonder if I should put it here, Unstoppable Body and Mind. I'm typing it too. Unstoppable Body and Mind. And if you look on YouTube, I have the audio and videos for, I think, most of my podcast episodes. And yes, I will be sending an email out with that offer for the Elevate the Book Club. And you can always look on my Instagram too, if you like Instagram or Facebook. I just have accounts in all those places. TikTok, if you're on there, but YouTube is a good one. You could I try to post everything there, and especially those podcast episodes. And I think I do have some just episodes that are me coaching. But if you also are, just like wondering if we're a fit, then let me know so that I can maybe we could do just a little consult or something. Okay. Or sometimes what I do is like a $49 clarity call, but you could apply that cost to what you buy. Okay. And then NNY says, you have a question. I don't know if you're still there, and we're a little over on time, but I could take a quick question. But maybe you've left. I don't know. I can't see everyone on the page. Okay. We can always do questions next week as well. We'll meet next week at the same time. And Mary says, I listened to a 10-minute graded exposure of Betsy's this morning. Very helpful. Oh, thank you. Yeah, my podcast has some meditations on it, and graded exposure is one of them. And I also have one for anxiety, for decreasing anxiety, a meditation. and something like inner child work, things like that. Okay, so I'm
Can I please ask my question? Sorry, I was trying to
oh
figure it
yeah, you
out.
are okay. Yeah, okay. Good
Hi,
timing.
my name is Carol. So I was wondering if plantar fasciitis could be TMS as well.
Yeah, yeah, for sure. Yeah, it's one of
Okay.
those types of things where it's like the brain has those neural circuits to all the areas of the body. It can cause fascia to tighten up. It can cause muscles to tighten up. It can cause nerves to be compressed because of the muscle tightness. So the brain's in control of all of that. So if you've had an injury and it's less than like 3 to 6 months, then there's a chance it might not be neuroplastic, but I would really err on the side of this is something neuroplastic. And I would look at those fit criteria, like I told Dawn, and just really be that observer and see if it varies at all, if it is like worse with stress, things like that. Have you looked at the fit criteria before?
Sorry, I'm changing diapers. I'm
Oh,
sorry.
no.
Yeah, so
Very
it started exactly a week before moving to the new house. I was so stressed about the house and the move, and it's been for 6 months.
Yeah. Yeah. So definitely the more you're thinking of it as this is because of stress, this is because of emotion, and sending your brain those messages of safety and, doing this PRT, pain reprocessing, and this kind of stuff, that pain will go down. But right now it sounds like your nervous system got really activated. And so it's like your brain's kind of turning up the symptom in this one area. And what you want to do is like not focus on it so much, not try to fix it so much, not be afraid of it so much. And then the brain produces it less and less. Oh, okay. And then my podcast is on all the platforms, I think, iTunes and Google and Spotify. And I think you can find it everywhere that podcasts are. If you can't find it on your podcast platform, let me know because I want to get on it. But I think I'm on all of them and on YouTube as well. Okay, awesome, you guys. I will see you all next week. We'll do chapter 2. All right, take care. Have a good week, guys. Bye.